All right, let's jump right in. In this explainer, we're creating a practical guide for pharmacists on managing anxiety disorders. We're going to cover the essential counseling points and clinical pearls you need to really navigate this complex and super important area of patient care.
So, just how big of a deal is this? Well, check out this number. The lifetime prevalence of anxiety disorders is a massive 31%. That means about 1 in every 3 people who walk up to your pharmacy counter will deal with one of these conditions. Our role here is absolutely critical.
So here's our game plan. We're going to walk through this just like a clinical workflow. First, we'll survey the landscape of these disorders, then we'll lock in our therapeutic goals, cover the first-line meds, and spend a good chunk of time on counseling. Then we'll see what's next.
Okay, let's kick things off with Section 1, the anxiety disorder landscape.
You know, anxiety isn't just one thing, right? The DSM-5-TR breaks it down into several distinct disorders. For us at the pharmacy, knowing the key difference, like the sudden, abrupt attacks and panic disorder versus that constant nagging worry in GAD, it helps us frame our conversation. It's that first step to really understanding what a patient might be going through when they hand you that new script.
All right, Section 2, Diagnosis and Therapeutic Goals. This is all about knowing where we're going before we even start the journey. What are we actually trying to achieve for our patients?
Look, it's so important to remember, we're not just trying to dial down symptoms. The real goal is functional recovery. We want to help patients get back to their lives, Back to work, back to their families, without anxiety holding them back. It's all about restoring their quality of life. This is where our pharmacist's eye for the big picture is so valuable. A good workup rules out other things that can look a lot like anxiety. Think thyroid problems, for instance. So when we get that prescription, being aware of the patient's full med list and history is just vital before we start counseling.
And that brings us to Section 3, our first-line agents, the SSRIs and SNRIs. This is really the foundation of how we treat anxiety with medication today. We all know these are the go-to drugs. But why? It really just boils down to 2 key things: tolerability and safety. When patients ask you about older meds they've heard about, this is your answer. Their better side effect profile and safety in overdose makes them the clear choice to start with.
You know the drill, start low, go slow. That is absolutely key here. But really look at this timeline. Initial improvement might not show up for 2 to 8 weeks, and optimal results, that could take up to 12 weeks. This delay is probably the single most important piece of information for our initial counseling.
Which leads us perfectly into the most important part of our role, Section 4, crucial patient counseling points. This is where we, as pharmacists, can truly make or break treatment success.
Seriously, if you remember one thing today, make it this. Patients feel the side effects almost right away, but the anxiety relief, that comes much, much later. If we don't give them a heads up, can you blame them for stopping after a few days? They think the med is just making things worse.
And here are the usual suspects: nausea, headache, and the really tricky one, sometimes even a temporary increase in anxiety. We have to tell patients that these initial effects usually fade in the first couple of weeks as their body gets used to the medication. That little bit of reassurance can make all the difference for sticking with it.
So, once a patient is feeling better and they're stable, another question is bound to pop up. What happens when it's time to stop the medication?
And the answer here is crystal clear. There's no wiggle room. You never, ever stop these cold turkey. Discontinuation syndrome is a real thing, and it can be miserable. The only safe way off is a slow, gradual taper, usually over several months, with the prescriber guiding the way. This is a huge safety point to drive home.
Our counseling doesn't stop at the pill bottle, right? We've got to talk about lifestyle. Reminding patients that stimulants like caffeine can pour fuel on the anxiety fire, or that using alcohol to cope actually backfires. These are actionable things they can do to help themselves get better.
Okay, on to our final section, beyond first-line treatment. What happens when SSRIs aren't the whole answer, or we're dealing with more specific patient populations?
This slide really captures the essential trade-off in anxiety treatment. On one side, you have benzodiazepines. They're the sprinters. They work fast for acute situations, but come with big risks like dependence. On the other side, you have the SSRIs. They're the marathon runners. Slow to start, but they're the safe, sustainable choice for the long haul. 2 different tools for 2 very different jobs.
So, the best way to think about benzos is as a short-term bridge. Their main role is to help manage those really tough acute symptoms for a few weeks while we're waiting for the first-line SSRI or SNRI to kick in. They're temporary support, not the permanent solution.
Now, managing anxiety during pregnancy, this requires a ton of care. The true first-line approach here isn't a drug at all. It's therapy, like CBT. If medication is needed, paroxetine is one we generally avoid because of cardiac risks. The preferred SSRIs are usually citalopram, escitalopram, and sertraline, but only after a very careful risk-benefit talk.
And for breastfeeding mothers, the guidance shifts just a little. Here, paroxetine and sertraline are often the top choices because very little gets into the breast milk. Benzodiazepines, though, are a definite no-go. There's a real risk of it building up and causing sedation in the baby.
So I'll leave you with this question to think about. We know that these medications don't work the same for GAD as they do for panic disorder or social anxiety. As pharmacists, we're right there on the front lines, getting real-time feedback from patients. So how can we use that unique position to help tailor and personalize this journey for every single patient who trusts us with their care?